Good morning, everyone. Continuing with the ABWM prep, we're going over anatomy and physiology. First question, which fibroblasts have contractile properties? These would be your myofibroblasts. They express alpha smooth muscle actin, and they secrete type 1 collagen. The transformation from fibroblast into myofibroblast is dependent on transforming growth factor beta, platelet-derived growth factor, EDA fibronectin, and the tensile stimulus coming from wound healing. Myofibroblasts are present in the granulation tissue 3 to 5 days after the initial wounding. They participate in wound contraction through excessive cell matrix contacts, which are called supermature focal adhesions. Myofibroblast apoptosis occurs after wound healing and reepithelialization. Next question. What role do myofibroblasts play in hypertrophic scarring? So hypertrophic scarring is similar to keloids. However, hypertrophic scarring is a raised scar that typically remains in the scar lines, whereas keloids can actually grow outside of the scar lines. Answer is in pathological wound healing with hypertrophic scarring, myofibroblast activity persists, meaning no apoptosis, and this leads to tissue deformation and severe contractions. Next question. What is the role of the extracellular matrix? So the extracellular matrix is a non-cellular component within the tissue and organs that provides a scaffold for cellular function. So basically the scaffolding for all the inflammatory process and then the healing which is going on within a wound. Cellular adhesion is mediated through receptors such as integrins, which we'll get into here. The next question, what is a cellular adhesion molecule or a CAM? CAMs recognize and bind similar proteins on cells or extracellular matrix components. They are critical to leukocyte extravasation and cellular migration in wound healing. The five principal classes of CAMs are cadherins, immunoglobulins, mucins, integrins, and selectins. Next question. Monocytes are recruited to the wound through homing mechanisms and become this cell whose function is what? And if you look at the slide there, it's an image of a macrophage. So after monocytes extravasate from vessels into injured tissue, they are referred to as macrophages. They constitute 2 to 10% of circulating white blood cells. Macrophages ingest and destroy debris with continual lysosomal activity and regeneration and become the predominant cell population in the wound until fibroblast migration and replication occur during the proliferative phase. So again, the four phases of wound healing, we have hemostasis, inflammatory phase, which is going to be mostly your macrophages, proliferative phase, which is going to be mostly your fibroblasts, and then remodeling. Um, Macrophage migration into the wound site is the transitional marker between inflammatory and proliferative phases. Macrophages' major contributions to wound healing are the production of cytokines, complement proteins, reactive oxygen species, protease inhibitors, and growth factors such as tumor necrosis factor alpha and beta, interleukin 1 and 6, platelet-derived growth factor, and then transforming growth factors alpha and beta. Macrophages typically peak within 2 to 3 days of the wound. How do macrophages respond to hypoxic environments? Wounds exhibit hypoxic environments either by vessel damage or by intense cellular metabolic activity. In these environments, macrophages promote angiogenesis and in the formation of granulation tissue. Next question, which cells are the last to arrive during the proliferative phase? Again, hemostasis, inflammatory phase, mostly macrophages, proliferative phase, mostly fibroblasts, and then remodeling phase. So the last cells to arrive in that third proliferative phase would be your T lymphocytes. They peak at about 7 days. They migrate from the bone marrow to the thymus under your sternum, where they mature, and then they make their way into the bloodstream and eventually to the wound. Name three functions of T lymphocytes. So directly target and kill antigen-bearing cells. These are our cytotoxic T cells, the main group of T cells. They can also activate macrophage or B lymphocytes. These are called helper T cells, or they can downregulate inflammation and proliferation. And these are our suppressor T cells. Next question. This cell is considered the first line of defense and is recruited to the wound within a few hours. So the first cells at the wound are typically going to be platelets, but the first line of defense would be neutrophils or polymorph nuclear leukocytes. They serve as the first line of innate immune defense and are recruited in bulk to the wound site within a few hours. They're the most abundant white blood cells in the circulation, accounting for 45 to 75% of circulating white blood cells. During degranulation, PMNs develop a phagocytic vacuole at the cell membrane that engulfs and degrades bacteria and debris. Mature neutrophils undergo apoptosis or cell death soon after bacterial phagocytosis. This constitutes the primary component of pus. So typically, these cells last about 48 to 72 hours, and when they die, they do form pus, which will either form a slough which needs to be removed, or pus under the skin which needs to be drained in one form or another. So stay tuned for episode 3 and a little bit more fun with the ABWM prep.